we're going to talk about how signals get into the spinal cord. Okay, so let's put my spinal, I'll just draw half a spinal cord over here, okay, where I've got my posterior gray horn, my lateral gray horn, and my anterior gray horn, okay? So something that we tend to forget is that spinal nerves are mixed. So they're going to be a combination of afferent signals, or sensory, and efferent signals, which are going to be motor. These signals are going to be coming in through the same nerves, but just the axons are moving in different directions, okay? So except for once they get to the actual spinal cord, okay? So let's start with my sensory, okay? So my sensory is going to come in through the dorsal root, okay? And just before the dorsal root, there's this large kind of swelling called the dorsal root ganglion, which is going to I think of the ganglion as sort of a brain trust of signals that of nerves that come together. They're going to receive signals from a number of sources. So there is a source that comes from the back, okay? That source from the back is called the posterior ramus. And this is going to communicate information about essentially your back. And it's going to be mostly somatic signals, but we'll see some visceral signals from things like your sweat glands and what have you. You're also going to have an anterior ramus, and it's going to be much larger. Okay, this anterior ramus is larger than the posterior ramus because that anterior ramus is going to send information about your trunk, like your torso and everything, as well as your limbs, okay? And it's going to be, again, primarily somatic in its purpose. It does have some other kind of more interoceptors within there. But when we're thinking about visceral signals, most of our visceral signals are going to be coming from what we call the rami communicans. The rami communicans. These are going to be sending visceral signals. Okay? And so anything that we are feeling like blood pressure, oxygen levels, all of that gets communicated up through those rami communicans. Now, remember what I said. These are going to be mixed signals, right? So when I think of a mixed signal, right, I have sensory, so I showed you all the things that come in sensory-wise, but we still have motor signals. These are going to, so both the ventral side as well as the lateral side are going to speak through that anterior gray horn. They're going to go out, and they're going to go out through this ventral root for motor signals. Okay. And those motor signals are still going to go through those same pathways. So if I have a visceral thing, like I'm going to raise my blood pressure, I'm going to do a motor thing to regulate some visceral. I'm going to go through those rami communicans. If I'm going to wiggle my fingers, I'm going to go through my anterior ramus. If I'm going to arch my back, I'm going to go through that posterior ramus. So all three of those regions still communicate into the spinal cord and out to the spinal cord. It's where they diverge is from is through those roots. So those dorsal root and those ventral roots. I hope this helps you with kind of orienting which signals go where and how they are processed.